If you're a man who's been silently struggling with performance issues, feeling frustrated, embarrassed, or even ashamed to talk about it, you're not alone. But I want you to know something important. There is hope, and it may be simpler than you think. In today's video, I'm going to reveal a powerful, research-backed vitamin that is not only affordable and easy to find, but has been shown to significantly improve erectile function by enhancing the body's natural physiology. No gimmicks, no false promises, just real science and practical strategies that can change lives. My name is Dr. Fiona. I'm a urologist specializing in male health and sexual function, and I've worked with countless men who thought the only way forward was through medication. Many of them were wrong. And what I'm about to share with you could be a game changer for your confidence, performance, and overall vitality. So stay with me. This might be one of the most important health conversations you have this year. Erectile dysfunction is a highly relevant and frequently discussed topic in clinical practice. More and more patients are seeking natural alternatives before considering pharmacological treatments, and that makes perfect sense. According to the American Urological Association and numerous recent clinical studies, lifestyle factors such as nutrition, physical activity, sleep quality, and stress management have a direct and measurable impact on erectile function. In fact, an erection is a complex physiological event that involves cardiovascular, neurological, hormonal, and psychological systems all working together. That's why we've extensively covered this subject on our channel. The curiosity and demand for holistic strategies that support erectile function naturally are growing rapidly. Now, let me introduce you to a vitamin that is familiar to many, but rarely recognized for its role in male sexual performance. Surprisingly, it can have a powerful effect in supporting stronger, firmer, more reliable erections. I'm talking about folic acid, also known as vitamin B9. Folic acid is traditionally prescribed for women during pregnancy, primarily to prevent neural tube defects in the developing baby. But more recent studies have shown that this same nutrient plays a crucial role in male vascular and neurological health, both of which are essential components of erectile function. But how exactly does folic acid work to improve erections? It supports erectile function through two primary mechanisms, both of which have been supported by consistent scientific findings. The first is protection and improvement of endothelial function. The endothelium is the thin layer of cells lining our blood vessels. It plays a vital role in regulating blood flow and vascular tone. Since an erection is essentially a surge of blood flow to the penile tissues, a healthy endothelium is key to achieving and maintaining strong erections. By improving vascular health, folic acid helps ensure that the arteries, especially the penile arteries, can effectively deliver the required volume of blood to the erectile tissues. Interestingly, folic acid deficiency is linked to elevated levels of homocysteine, an amino acid that, in excess, damages endothelial cells and increases the risk of cardiovascular disease and erectile problems. So, by correcting this deficiency, folic acid helps restore optimal vascular function, supporting not only sexual performance, but also overall circulatory health. The second mechanism involves one of the most important neurotransmitters in sexual function, nitric oxide, NO. Nitric oxide is responsible for causing the dilation of blood vessels, a process that enables greater blood flow into the penis and relaxes the surrounding smooth muscle tissue. This vasodilation effect is what allows an erection to occur. Folic acid enhances the production and bioavailability of nitric oxide in the body, particularly by supporting the function of endothelial nitric oxide synthase an enzyme that plays a central role in nitric oxide synthesis. In simple terms, folic acid doesn't act as an instant stimulant. Instead, it works by optimizing the biological systems that govern natural arousal and erectile strength. It's part of a broader therapeutic approach, especially beneficial for cases of mild to moderate erectile dysfunction, and can serve as an important addition or alternative to pharmaceutical options. So now the question is, what's the right dose? According to clinical research, the recommended and effective dose of folic acid for improving erectile function is 5 milligrams per day. This dosage can be taken as a single daily tablet. Of course, it's always best to initiate supplementation under the guidance of a healthcare provider. A thorough evaluation by your urologist can determine whether your erectile dysfunction is mild, moderate, or severe, and help customize a treatment plan based on your individual needs. It's worth emphasizing that folic acid doesn't work in isolation. It can be combined with other vitamins and nutrients that offer synergistic benefits to sexual health. These include vitamins B2, B6, B12, betaine, and magnesium, all of which support homocysteine metabolism, vascular function, nerve signaling, and overall male vitality. I will be discussing these combinations more deeply in another video, but for now, I want you to recognize how powerful this one vitamin, folic acid, can be. It's safe, affordable, and clinically supported. It can be taken on its own or in conjunction with other therapies, including medications like sildenafil or tadalafil for those who need them. It's a valuable tool in the treatment toolbox for erectile dysfunction. And finally, let me leave you with this message. Taking care of your sexual health is not just about intimacy. It's about quality of life, self-esteem, confidence, emotional connection, and, believe it or not, cardiovascular health. Often, erectile dysfunction is the first warning sign of systemic health issues like hypertension, diabetes, or early atherosclerosis. Don't ignore it. Take action. If this information resonated with you, share it with a friend, a partner, or a colleague who might benefit from it. Your sharing could change someone's life because health education is one of the most powerful ways to create lasting transformation. Thank you for being here. Stay tuned to our channel. More vital content on men's health is coming soon. Take care, and I'll see you in the next video.